What experience do you have as a registered nurse?
As a new graduate nurse, I started working in Valley Regional Medical Center as a medical floor nurse, 2 years graveyard shift. Then I moved to days for 2 more years. Um, then I went to Fresenius Hemodialysis Center where I worked for 2 years. And currently I'm working as a lead regional nurse, coordinator slash supervisor for Southwest Key Programs, which is a shelter for immigrant kids. Um, so yes.
As a nurse, how do you interact and establish relationships with your patients during teaching and health counseling?
I start by assessing how well educated they are. I like to know about their religion. I like to know their background ethics. I like to know from um, from where they're coming, their origins, to see what barriers I'm gonna face. Um, I like to know how much they know about their disease, about medications, and I try to make conversation with them, letting them know who I am. Also telling them about their doctor if they have any questions regarding the doctors, because sometimes patients feel bombarded by so many doctors, so sometimes you have to explain each doctor's role, who's the specialist, what their role is, who's the primary doctor, what role I'm playing, what's the phlebotomist doing there. Um, that's how I establish relationships with my patients.
Okay. What type of barriers do you face in establishing trusting relationships with your patients?
Usually, the most common ones are religion,
Mm-hmm.
since a lot of religions prevent uh, patients from even making decisions on their own. For example, Jehovah's Witness will deny a blood transfusion because of the religion, even if they're at very high risk of dying, they won't accept it. So that's one barrier. Language is another barrier. Um, I'm bilingual, so I can fluently speak Spanish as well. And but when they're from other countries, it's hard. But I use everything I can to communicate with them, like a translator over the phone, or sometimes we're lucky enough to have a coworker that speaks their same language, so they will translate for me.
Okay. As a nurse, how do you show compassion toward a patient who is a child, a middle aged adult, and a senior?
For a child, I try to make everything as simple as possible, and also by creating a safe environment. Always having a smile on my face. I don't. The last thing I want is to scare them. Explain everything step by step. Um, with a middle-aged adult, it's much easier, uh, but it depends on their. It all depends on the patient's point of view. So you also have to assess them and educate as much as possible. Answer every question. With a senior, I would compare a lot with a child, since you also have to be very patient, very understanding, and answer any questions they have. Um, I show my compassion by being present, being there at the moment, listening is very important. They want to be listened, and they want you to understand what they're going through. So yeah, listening is a very precise way to show your compassion.
Okay. How do you manage to keep good relationships with your coworkers?
By being a team player, it's a very good way to keep a good relationship with your coworkers. Um, Also by communicating,
Mm-hmm.
since communication is a big part of being a team player. By letting you, like, if you're missing something, you're gonna tell your coworker, hey, can you help me on that, or showing your availability. So me as a clinical coordinator, I have to be always available, make myself available for whenever they need me. I step in and show, I mean, um, help in whatever they need, and
Mm-hmm.
that's how I keep good relationships. Being a team player, I think it's the key.
Okay. Have you ever had a problem with a coworker that had to be settled with the help of upper management? If so, what was the issue and how was the issue settled?
I had this problem with my nurse, also an RN, a coworker. She wouldn't help when we were very busy. Um, I went up to my manager. This was back when I worked in dialysis. Um, he made a meeting, uh, but I don't. The issue wasn't settled since he had favoritism, which was very obvious. That's another thing you should avoid, favoritism. So no, to me the issue wasn't settled, uh, but by him just bringing it up in a meeting, uh, he thought it was enough. But this coworker continued with the same behavior, and so no, it wasn't settled.
Okay. Have you been in a situation where you believe that a physician's orders were questionable and could cause the patient harm? If so, what were the orders and how did you go about handling the situation?
I had a diabetic patient who had two insulin orders. One was a regular sliding scale, which is as needed, and the other one was Lantus insulin. Um, the patient was always running low on his blood sugars, and the family wasn't very educated on how to handle the situation. So I, of course, educated them, but then I also called the doctor to let him know that the patient had a very high dose of Lantus and it had to be either decreased or discontinued. Um, so as soon as the doctor looked at the labs, he found out how the blood sugars were trending, and he made some changes. I can't really recall what he changed, but the patient since then was running very good blood sugars, and that was that.
Okay. Have you ever witnessed unethical behavior from your coworkers? If yes, what was the behavior and how did you handle the situation?
One of my coworkers at the dialysis clinic, which is a very big room, with it's just one room where we're doing the treatments. So a tech coworker was saying a lot of bad words,
Profanity?
profanity, yes, and he thought nobody could hear him, or he felt like he was the only one in the room. So I called him to a side of the clinic, um, I made myself clear with him, and I explained him that he was very disrespectful to the elderly patients, because that's the majority of the patients are old people. And so I told him to stop the behavior, which was very unethical, and he understood. We he was I mean he did not get mad or anything, because I know this coworker very well, so I know how to approach him. So he,
So you would also have to know how your coworker is, right?
yes, you have to get to know each like, and they're never gonna respond in the same way. I mean, they're all different, and you have to also know how to approach each one.
Okay. Have you ever found yourself sexually harassed by a patient, family, or coworker? If yes, how did you handle the situation?
When I worked at the hospital, I was verbally harassed sexually by a patient. So what I did is that I went up to my chart. I followed the chain of commands. I went to my charge nurse, and then I just switched patients with a male nurse. So the male nurse was assigned to the patient, and I kept one of his patients. So that's how we handled the situation, since the patient wasn't psychologically all there. We couldn't we didn't want to confront him, so we just switched, and from there on we never assigned a female nurse to that same patient.
Okay. How do you establish a nurse-physician relationship?
I think that you have to build rapport with your physician in order to establish a good relationship with your doctor, by knowing your patient status, by knowing their diagnosis, their lab reports, medical history, by being ready when the doctor comes and he starts asking you all these questions regarding the patient. That's how you build a good relationship with a physician. You have to show that you know what you're doing as a nurse, that you're playing your role.
Okay. Have you ever been verbally or physically abused or intimidated by a physician or a supervisor? If so, how did you go about handling the situation?
Well, I've never been verbally or physically abused, but intimidated, yes, by physicians. Uh, I consider myself a very shy person, and so it's a daily challenge for me to talk to doctors, since yes, I do feel very intimidated. So like I said, I prepare myself, and that's how I overcome that intimidation, by being ready. It's a way to prevent it, but like I said, it's a daily challenge, and I think I'm never gonna get over that.
Yeah. Okay. Now that you are a nurse, medical coordinator, and upper management, how do you go about establishing relationships with your new coworkers who are of lower power?
By always being there, by being a team player, by being an example, by showing respect, always being friendly, and showing that I care for my patients and that they're the priority, not us, that the work has to get done. because of them, because of the patients, not because of us. And I'm the nurse.